for a playoff edition of the Sterling Health Feature with Travis Sterling of Sterling Physical Therapy, who is contracted with Pella High School for on-site injury evaluations. And Travis, throughout the season, as we've done our features and talked about different injuries and such, one of the things that always seems to come up is inflammation or swelling. Tell us a little bit more about that. I know it can happen with any injury. How does that end up affecting somebody?
If you have swelling in a small confined space like a joint, it will push out, causing the joint to be very stiff, painful, and we've all experienced that. So it makes it hard to play a sport or just get around throughout the day. You can also have swelling in a tendon complex between the tendon and the sheath, making the tendon just not move as efficiently as it should. You can also have swelling in the muscle, just causing pain, sore to the touch, more sensitive to the bumps and bruises we get.
How does physical therapy help with swelling and inflammation?
The first thing we'll try to do is to get the swelling down right away, and that's really the name of the game, is to get on it early. And even in 2011, one of the easiest things to do is icing. So we'll instruct the patient on how to do that, compressing it, so physically pushing the swelling out of the area. And then finally, we can do some hands-on things or utilize some machines that we have here in the clinic that uses electricity or drugs to get the swelling under control. But usually it's a team effort. It's not one thing or the other. It's kind of everything combined and using it in a smart fashion to keep the swelling under control and let the athlete or the patient keep active in what they want.
Are there any nutritional options that are out there for people that are maybe looking to combat inflammation before it happens?
Yeah, there's a lot of misinformation out there. Be up at midnight and see blue emu oil from Russia or someplace like that that's been scavenged recently found. You got to be careful with that. There's no real regulation of any non-drug nutritional products. So what we've kind of done is we follow NCAA rules, and the NCAA, if you follow them at all, they are very, very strict, probably as strict or stricter than the FDA. That's what we do to safeguard patients. And with that said, then, a couple products that we suggest, omega-3 oils. There was just some studies come out about how that can help arthritic symptoms or delay the progress of arthritis. Also, we've all heard about glucosamine, chondroitin, same type of thing. And then there's some other supplements that have an anti-inflammatory effect. And again, typically we'll suggest, a combination of those things for folks that are having some prolonged osteoarthritic symptoms. But we always tell them it's not going to magically cure the problem. It's just something to help keep them going, keep that joint healthy along with the physical activity we suggest.
Our thanks to tonight's guest on the Sterling Health Feature, Travis Sterling with Sterling Physical Therapy, where they provide you with the Sterling standard of care.